Hi, everybody. There we go. Okay. Hi, Rachelle Jones, Luncheon Live at 11:45. Well, almost 11:44. All right, so every week we come to you live, and I actually come to you from my car a lot of times because I meet with you guys and hang out for a little bit right before I pick up my youngest from school because she gets out at noon on Fridays. So there we are. Okay, so today I noticed, hey Cheryl, so just something I want to kind of distinguish a little bit what the differences are, just a little bit, just surfacey. At a basic level. So a lot of people, when they say I'm going to Rachelle's class, it's a class, but they'll say I'm going to therapy or I'm going to counseling or I'm with my therapist, and I'm not a therapist. I'm not a counselor. I'm not a psychologist or a psychiatrist. I'm an advanced grief recovery methods specialist trained by the Grief Recovery Institute trained a lot of times. And so a therapist or a psychologist, they're studying disorders of the mind. Disorders of the mind. Hi there, thanks for joining. So disorders of the mind, we can go to therapy, right? We think of grief. Grief is the feelings we have because of change or loss. Any loss or any change, your feelings bubble up. For your whole life, they just keep adding up and adding up and adding up. So as far back as you were born until this current day, you've been compiling a humongous, bigger than human-sized pile of grief. Unresolved grief is still in there, wreaking havoc, leading you to have certain thought patterns, beliefs, behaviors, actions, attitudes, habits. And so hi, thanks for joining. So habits and patterns, and they're not like living from a state of consciousness or a state of choice, a state of stillness. Those things, when we're acting out of habit, we're not really engaging, are we? It's a habit for me to, I don't know, when I have an itch, reach over and scratch it. I don't know, I gotta be honest, I have a gigantic headache that's on day 2, and my brain doesn't want to think all the way. Like the elevator doesn't want to go all the way up. So that's really not my favorite. But, okay, so if I have an itch and I just reach over and scratch it, right? That's like a habit versus, looking at it, examining it. Where do you think that's coming from? How else could I deal with that? Maybe a bug bite, right? A bug bite, I'm allergic to most bug bites. They swell up and they get ugly. But if I just reach over out of habit and scratch it, I'm just going to make it worse. There are some other things that I've had to do and play with and realize that are more effective than that short-term scratching. Does that make sense? So same thing. Sometimes we go to therapy because that's what we know. Which there's a place for therapists. They're amazing. They're wonderful. But I want you to consider, so grief, the feelings you have that bubble up because of loss or change, they store up for your whole life. So let's just say, what do I have here? I have my glasses and this bag of tissues, and I have a cup, okay? I have a cup. Now let's say these are the tools I have learned. Let's say we're going to, what are we going to do? Build a house. We're going to build a house. And these are the tools that I gave you. This is it. This is what we're going to do. This is what we have. First of all, if you make any progress at all, it's going to be small, right? But if that's all you've ever known, you're going to be super creative, like Survivor Man, right? You're going to be super creative because those are the tools that you've known. That's what you know to use. But let's think about it. Are those the best tools for the job of building a house or planting a tree? No, right? But if that's all I've ever known, hi, thanks for joining. If all I've ever known are those tools, I'm going to do the job to the best of my ability, but we all know that the job's not going to be done as well as it could be, because it's not going to be done properly, basically, because none of these are the correct tools for that type of job. And so using your mind, studying your mind, what's wrong with you, what disorder do you have, is not accurate or correct. when you have grief, it's sitting somewhere in this area, right? Think about it. When you think of that situation, that big change or that big loss that you experienced, do you feel it here? No. You might, though, over time, not dealing with your grief, get headaches or stomach aches or leg pain or autoimmune things starting to talk to you. Your body turns on itself. And that's just because it's got too much energy floating around. So then we go to the doctor and they prescribe us, they tell us we have anxiety and we start taking pills, or they tell us we have depression and we start taking pills. Really what you're having is a response, a normal and natural response or reaction to all this energy, but what you're using to heal it is not correct. That's why it doesn't work. That's why you can go to therapy for 17 years or 10 months or 10 years or whatever for your whole life and not actually feel completely different. You feel okay if you're in the therapist's office, but when you leave, the things are kind of brewing and still churning, and then you've got to go back because the job is not a head problem. You're going to the head doctor and you don't have a head problem. Anxiety, depression, those are just prolonged unresolved grief. So what you really need, what are some of the tools we use for dealing with grief? Oh, just don't feel bad. You just got to think happy thoughts. You just got to be happy, right? So we say, don't feel bad. They didn't mean to. Don't feel bad. It was an accident. Don't feel bad. You can try again, right? So we say, don't feel. And then one of the other tools we use is replace the loss. Just change your thought, replace your sad thoughts with happy ones. When that pain comes in, you just think something else. We have all of these like replace the whole sadness or replace the situation. You broke up, get a new relationship. You lost your pet, get a new pet. This whole replace the loss thing, that doesn't work. You had a miscarriage, make a new baby. Like we go into this replace thing. Well, that's a tool that's incorrect. That's like using glasses in a cup to build a home. Grieve alone. You just keep your feelings buried inside. You don't talk, don't cry completely. Don't show your humanness. Don't cry is perfect. That's a perfect example of a tool that's not correct. Hey, Bolty. Hey, brother and Jojo. Thank you for joining. So these are tools that we use that are not correct. Don't feel bad. Replace the loss. Grieve alone. Keep your feelings tucked inside. Keep busy. Just be really busy. Keep going. Keep going. Don't give yourself time to think or feel. And then we think that if we are busy enough, then enough time will pass and then we'll be over our grief, right? Nope, doesn't work that way. Give it time. Absolutely does not work. It's again, an incorrect tool for this grieving job. It's like using glasses and a cup to build a home. So we have don't feel bad, replace the loss, grieve alone, give it time, keep busy, and be strong. Be strong. What's that? I always am so curious. What does that mean? And when somebody says it, I ask them, what does that mean? And we think that too. We think that with our friends. We don't want to bring the energy down. Or I heard someone say it this morning. I feel sad to bring this sad topic up in front of you guys, to bring the energy down. We're so afraid of human feelings. We're not afraid of joy, but we're afraid of sadness, which is the exact same thing. It's just an emotion. They're both emotions. They're both part of being human. There's nothing wrong with them, but what happens is it doesn't feel good, and so we want to avoid it. Basically, grieve alone or just don't feel it. Tell me, does that work? Anybody, comment. Does time heal your pain? Often I hear, well, time does change it a little bit. You're right, it does change it. It puts a bunch of other layers and a bunch of other grief on top of it, so that one you're not aware of as much, but it's still there. It's just buried under the surface. Now you're just getting heavier and heavier. So don't feel bad. Grieve alone, give it time, replace the loss, keep busy, be strong. These are all myths. They're all incorrect tools for the job. And if that's what you've grown up knowing and learning and using, yeah, exactly, Cheryl. No, brother. Everyone's saying no, because none of these tools actually work. If you stop and think about something that hurts you, the energy is still there. And what it's doing, as long as you're ignoring it or isolating it or grieving alone with it, it's just affecting your body. It's eating up your body. It's eating up your heart, your mind. It's eating up your, giving you headaches, stomach aches, muscle aches. You get tension. And then what do? Well, we've got all this energy building up. It doesn't feel good. And so sometimes we explode, don't we? We respond at a level like 14 when really we only needed to respond at an energy level 2 or 1.5. So we overreact, we overrespond, or we overthink our pain, and it's really just because we're having a reaction that we're trying to ignore and then now manage and compress all of our energy. It just doesn't work that way. You are going to have those explosions, which will bring you short-term relief, just not long term. And then so what happens? You have enough of these situations that hurt you, and you're like a dry sponge. And every time one of these situations happens, it drops a little drop into your dry sponge. And so now you're saturated, right? You've had enough of these drops. They don't feel good. Now you're saturated. Boom! The next person who hits you, you're exploding. The next person. That's how your habits are born. You're responding out of a saturation point. But the thing is, what grief recovery does is squeeze out your sponge, bring you back down to neutral. It doesn't, that way you're not responding out of a saturation point. You're not responding out of a bunch of internal noise. You're not responding out of pain and habits and patterns. That you're able to stop and pause and connect with, what do I really feel? What's really going on? How do I really want to react or respond in this? Thanks, Cheryl. How do I really want to react or respond in this situation? You then take back control. When you do the work to set your full saturated sponge back down to neutral, take the saturation point. When you do that work, which is what we do in the class together, you bring your saturation point down to neutral, and then you have space between what happens and how you're going to react. Hey, Gabby, it also gives you power. It takes the power from that person, hoping that they're going to do something different, or that the world is now suddenly going to be safer, that the world is going to be, kind, or change their behavior, or change their actions, change their attitudes, change their beliefs. Hey, JC, none of that stuff's going to happen, right? As long as you're waiting for the world to change its ways, you're always going to be hurting and having that energy. So this is a way to take your power back. You find where you're saturated, and you do the work to set your saturation point back low down to neutral. So you respond. There's space between you and the external world, and you now have control of how you're reacting versus your habits taking over for you, versus your just, I don't know, this is what I've always known, taking over for you. And that way you're not using tools that don't make sense. You're going to use the tools that you learn that are actually correct for the job. Does that make sense? Are we tracking? We can't expect the world to treat us differently somehow, but what we can do is take our saturation point down, and we feel it differently. We need to talk about Hurricane Dorian. Yes, we do, which I'm going to have to come back to be honest, because I'm about out of time. JC, throw something in there. Is there something you'd like to say? How are you, by the way? How are you being affected over there? It looks terrifying and just devastating. Throw something up there, JC, if you have something. Anyway, so saturation point. I'm not sure when I think about it which angle you want me to go with that. So losing a loved one during the storm and then have to live in it. Yeah, that's horrifically painful. I think I might need to come back to that next week, next Friday lunch and live, or maybe we'll do a video this week about it. Because you're right. So I'm going to bring that back next week since we're sort of out of time. But that would be an immediate, really intense situation, wouldn't it? That would hit your saturation point. It would take all of your sensors. You lose someone in the storm that you're currently living through. I mean, talk about hitting your saturation point. And how do you bring your energy back down? That's what we do. Doesn't mean you don't miss the person. It doesn't mean you aren't sad. So there's a difference between sadness and the pain of grief. Did you know that? Who knew that? That we can be sad every once in a while, and it will be every once in a while, versus absolute pain, devastation, my body's getting eaten up by unresolved grief. Did you know that? It's different. When you feel that ping in your heart, or that punch in your gut, or that blow where your heart just feels like it doesn't want to beat, or you can't breathe, or there's weight on your chest, that's actually from grief, but just sadness of, I miss them. I wish they were here. I want to tell them about what I did today. That's a little different. It's a lot different, actually, and it's difficult to fully describe unless you've been through it. So I hope that helps you understand the difference. Sorry, everybody, alarm went off. Yep, our sense of pain shifts as we understand the concept of shifting with time. Yeah, and then understanding that time itself doesn't heal. It's time, it's the actions that you're going to take and apply within time. And you've got to learn them, because currently, most likely, you're using things like, oh, just give it time. Or if I stay really busy, then my grief will go somewhere. It won't, actually. It'll just bury down, and then you'll still have that work plus all the stuff to come. To deal with, and that's a lot of work. So just do it now. Learn your tools now. Make sure you have the thing is, you don't know unless you're using those tools. Another tool I'm going to throw out there is give it to God or pray about it. And I'm going to tell you that's an incorrect tool for the job, because if that was all that was needed, all pain would disappear the minute somebody prayed. And I just want anybody answer. Is that how it works for you? The minute you pray, the minute you read scripture, the minute you give it to God, does your heartache go away? Honestly. Be honest. I'm going to guess no. It doesn't for me, and it doesn't for anybody I've ever met. So maybe you've got a magic key or a magic, exactly, right? Thanks for answering. No, it doesn't go away. That, again, is a myth. It requires, if you believe in prayer and you believe in that type of spirituality, which I do, use the power of your prayer to help you in taking the actions, in learning the correct tools. Use that in addition to. Use that to give you courage and boldness and power when you feel weak, when you feel tired, to take the actions you need to take. But that all by itself is an incorrectly used tool. So when people tell you to grab that tool, know in your heart and mind it's incorrect. You can tell them if you want. And then make sure you're educating yourself with the correct tools to deal with heartache, because it's coming. We all have it coming in different ways. Maybe it's a friend who moves or doesn't talk to us kindly, or a relationship, or we can't get pregnant, or we did get pregnant but we lost it, or our kids are going away to college, or they're just growing and they're going in high school, or they've got an attitude, or they're not quite lining up the way you thought, or your health is going bad, or your finances aren't quite what you hoped. Do you see what I'm saying here? Grief is coming. It always is. And it never stops coming. And pretending as though it isn't there, just like ignoring it. Well, I gotta go. But ignoring it's not helpful. So anyway, thanks for joining today. Thanks for joining Luncheon Live at 11:45. I'm so thankful you joined this week. I look forward to meeting with you next Friday. Have a good day, everybody. Talk to you next time.